Imagine you walk into an old room. It's quiet, dust is floating in the air. You take a deep breath. And in that moment, a virus enters your lungs. Not from a human, not from a cough, not from a crowd, but that from the air itself. Within days, you are in a hospital bed struggling to breathe, your lungs slowly filling with fluids, doctors rushing, oxygen dropping, panic rising, and then silence. This is not fiction. This is hantavirus, one of the deadliest viruses most people have never heard of. A virus that does not spread like COVID, but can kill up to 40% of infected patients. And recently, it appeared again in one of the most unexpected places on Earth, a luxury cruise ship. Now, what exactly is hantavirus? Hantavirus is a zoonotic virus, meaning it originates in animals and spreads to humans. But unlike many other viruses, it does not need direct contact. Its natural hosts are deer mice, field rats, and wild rodents. These animals carry the virus without getting sick. They live normally, eat normally, reproduce normally, but they leave behind something deadly: urine, droppings, and saliva. When these dry out, they turn into tiny particles, invisible, airborne. And when a human breathes that contaminated air, infections begin. No bite, no scratch, no warning. Just one breath. That can be enough. So how did it originate? Story of hantavirus goes back to the Korean War in 1950s. Thousands of soldiers suddenly developed a mysterious illness: high fever, severe bleeding, kidney failure. At that time, doctors had no idea what they were dealing with. Years later, scientists traced the disease to rodents living near the Hanta River in South Korea. That's where the name comes from, hantavirus. Since then, different strains have been discovered across the world. Two major categories. Number one, Old World hantavirus, which is Asia and Europe, causes hemorrhagic fever with renal syndrome. This type mainly affects kidneys and blood vessels. And second, the New World hantavirus called Americas. This is dangerous one. It causes hantapulmonary syndrome, and this form attacks the lungs directly. Now, what happens inside your body? This is where the things become truly terrifying. Hantavirus does not behave like a typical infection. It does not slowly progress. It waits and then strikes. For the first few days, symptoms look harmless: fever, body aches, headaches, just like flu-like symptoms. People might think they have flu, like fatigue. Most patients think it's just a flu and they ignore it. Now, phase two, the turning point. Suddenly, everything changes. The virus begins attacking the blood vessels in the lungs. These vessels become leaky. Fluid starts filling inside your lung tissues. Patients experience severe shortness of breath, chest tightness, rapid breathing. One survivor described it as, "I felt like drowning while I was still alive." Phase 3, critical collapse. Within hours, oxygen levels crash, blood pressure drops, organ begins shutting down. Patients rush to the ICU. Many require ventilators, and even with treatment, mortality remains extremely high, between 20 to 40%. This is not a mild virus. This is the life-threatening respiratory collapse. And now the cruise ship incident that we are hearing about. Let's talk about that. What brought hantavirus back into global attention? A cruise ship, thousands of miles away from wilderness, became the center of an outbreak. Passengers traveling from South America started experiencing symptoms: fever, weakness, breathing difficulty. At first, nothing unusual, but then cases escalated. ICU admissions began, and deaths were reported. At least 3 people died. The virus identified: the Andes strain of hantavirus. This strain is extremely rare because, unlike most hantaviruses, it has shown limited human to human transmission. That's what triggered global concern. Now, important reality check. Despite the fear, experts confirm it does not spread easily. It is not like COVID. It does not cause mass outbreaks, but still, the fatality rates make it dangerous. The Simpsons myth. Now, let's address something viral on the internet. Many people claim The Simpsons predicted hantavirus. Clips started circulating online, people linking old episodes to this new outbreak. But there is the truth. There is no episode that mentions hantavirus. What the show depicted was a fictional outbreak scenario, not a real prediction. This is a classic example of pattern recognition plus internet exaggeration. People connect random events and create a false narrative. So, why this matters? Because misinformation spreads faster than viruses, and in health, wrong information can be dangerous. So, why hantavirus is so deadly? Hantavirus is not globally widespread, but it's uniquely dangerous. Number one, silent exposure. You don't know when you are exposed. A simple dusty environment can infect you. Number two, late diagnosis. Symptoms mimic common flu. Doctors may not suspect it early. And number three, no specific treatment. There is no antiviral cure, no widely available vaccine. Treatment is only supportive, oxygen therapy, ICU care, and ventilation. And the rapid deterioration. Patients can go from normal to critical in just 48 hours, guys. How to protect yourself then? Now, the most important question: how do you stay safe? Avoid rodent exposure, keep surroundings clean, seal entry points in homes, store food securely. Safe cleaning practices: never sweep dusty rodent infested areas. Instead, spray disinfectant first, use gloves and masks. Travel awareness: avoid abandoned cabins or huts. Be careful in rural or forest areas. Do not sleep on bare ground. Early action: if you develop flu like symptoms after exposure, seek immediate help. Early care increases survival chances. Now, hantavirus is not a pandemic, at least not yet. It does not spread across cities rapidly, but it reminds us of something important. Not all deadly threats are visible. Some exist in silence, in dust, in air, in places where we never think about. So you don't need a crowd to get infected. You don't need contact. Sometimes all it takes is one breath. You are watching Dr. Raza, Health 360 MD. Your better health is my mission. Stay safe and God bless. Goodbye. My name is Dr. Raza. I'm a practicing family physician in USA for the past 18 years. I'm an American board certified physician and diplomate of American Board of Family Medicine.